We are absolutely delighted to have welcomed Miss Dr. Usha Mathur back to our pavilion. Wonderful. Today she'll be sharing her insight on arthritis and joint pain, a condition that touches many of us or all of us, I'm sure, at this age. Hopefully, her talk will be focusing on understanding arthritis ourselves, simple strategy to ease the pain, and practical steps we can take to improve the mobility and the quality of life at our age of 78 plus. So, Dr. Mathur, on to you.
Thank you
Please.
so much. Thank you so much, Ajit ji. And warm greetings to all the listeners of my talk. I'm Dr. Usha Mathur, and today we'll be discussing the condition affects millions worldwide, which is related to our very important part of the skeletal system, and it is joints, which the inflammatory condition of the joint, which is very, very stressful, is arthritis. In view of this, we'll talk about the joints, arthritis, and the movements. Should I start with the joints now?
Please.
Joint is a joint is a point where two or more bones meet, allowing for the movement and flexibility of the skeletal system. Joints are crucial for various movements, which are based on the type and amount of movement that allowed on that particular joint. There are, according to the function of the joints and their anatomical structure, there are many types of joints: movable joints and slightly movable and freely movable. Immovable joints are called synarthrosis. Slightly movement is amphiarthrosis, and freely mobile joints are known as diarthrosis. The immovable joints are the sutures of the skull bone, and they don't move. Once they unite, they are not moving. Slightly movable are the vertebral column. These are vertebrae of the spine, which are slightly moving. They do flexion, bending forward, and straightening. Freely movable right diarthrosis joints are those joints where perform the free movements in the body. These are shoulder joint and the hip joint. Now, according to the structure, anatomical structure of the joints, there are many types of joints. According to their structure, ball and socket joint, for example, shoulder, which performs a wide range of mobility. Then hinge type of joints, like knee joint, they have the bending and the stretching exercise. Then gliding joints, these are the wrist joint, which perform side to side movement and forth and back, backward and forward. Then fibrous joints, these are the skull sutures, which once they are united, they don't move. Slightly movement permitting joints, these are the vertebrae joints of the spinal cord. So, according to their dimension and their structural movement, they are helping our skeletal system to perform our day-to-day activities of the life. And now we'll discuss about the structure of the joint. In the structure of the joint, there are two portions of the bone. These are articular surfaces. And when these two come closer, there is some structure in between these. So the articular surfaces does not touch each other and produce a friction, and this way eroding the joints, bones. They have a space in between that is a capsular, that is called capsule. In that capsule, there is the cartilaginous portion, which is the cartilage side, and some fluid inside that gives the freely move it, lubricate the joint, and prevents the friction of the joint bones. That is synovial fluid. This capsule is covered, lined by the membrane, which is synovial membrane, and this is how the joint is capsulated. So the inside fluid doesn't flow out, and the cartilage and that doesn't come out. Now this joint is then supported by the tendons, ligaments, muscles, and all these structures which are supporting this joint to be at its place. Because of all these surrounding attachments, joints does not move from their position. They does not dislocate. They does not tear away. That gives the stability to our skeletal system. Then comes this synovial membrane, which encapsulates the joint. This helps to protect the joint from the other infections, then injuries or anything, any friction, any pressure on the joint. This synovial fluid that bears the pressure, outside pressure, and the cartilage in between the joint that does not friction between the joint bones does not happen, and this prevents this secures the joint. Then there are many types of joints, small joints, large joints. Large joints are shoulder, knee, hip. Small joints are wrist joints. They have some side-to-side movement. Different types of joints, ellipsoid joint, synovial joint, this according to their anatomical structure, and they perform all the movements, some side by side, to and fro. But freely movable joints are shoulder joint and knee joint and hip joint. They have all the knee joints. Knee joint is that does the bending and straightening, while shoulder performs all the movements: rotation, flexion, abduction, adduction, supination, pronation, all the joints, these perform on the shoulder. Same with the hip. We can put our legs apart, we can forward movement, backward movement, side movement, all the hip, on the hip we can perform all the movements. Now, normal joint is always very helpful, but once it gets infected, that's very painful, and that is called the arthritis. There's a small saying that sitting is like a smoking, while long-term sitting is equal to the poisonous effect of the smoking. So one should not sit for a long time. This causes stiffness of the joint, at times joint pains when we get up, especially the elderly person like us. When we sit for a long time in the same position and we try to get up from that position, we feel giddy at times, dizziness, because hypotension ho jata hai. All the blood, while we are sitting, the blood is collecting in the lower part, peripheral part of the legs, and our brain is not getting that blood. When we stand up suddenly, to hypotension, blood pressure falls. And this falling, legs try to push the blood upwards, but brain doesn't receive that quickly, and we feel dizziness, giddiness, at times we fall. So whenever we are sitting for a long time, we should slowly straighten our legs first, move some foot movements, some pumping of the foot, we can do that, and then we should get up. So when the joint is inflamed, it gives restriction of the movement, painful movements, and at times swelling appears on the particular joint which is infected. And with the swelling, there is redness, hot, the joint becomes hot and red and hot, and movements are restricted. So this arthritis is a very, very painful condition for a person who is suffering. According to this inflammation of joints, there are many types of arthritis. Most commonly is osteoarthritis, then comes rheumatoid arthritis, then is gout, and one more is the psoriatic arthritis. Osteoarthritis is caused by the over wear and tear of the cartilage of the bone because of the long-term use And over time of our age, as age advances, it becomes wear and tear of the joint cartilage appears. And mainly affected affect this wear and tear of the cartilage is the knee joint, hip joint, spine, and hands, especially fingers, small joints. Little joints are always more commonly infected. Then is a rheumatoid arthritis. It is an autoimmune type of infection in which the immune system, uh, our own immune system attacks the joint linings, and that destroys the joint system. Then in this rheumatoid arthritis, one or many joints can be involved. Symptoms include the same pain, swelling, fatigue, and warmth around the joints. This is the sign of our joint inflammation. Then third is the type of arthritis, which is gout. This is also a sort of waste products, which is developed in our body, uric acid. This arthritis becomes because of the deposition of the uric acid salt that hinders the joint movement and infects the joint. This is also type of autoimmune, some sort of that thing. Then fourth is psoriatic arthritis. This is the type of arthritis which mostly affects the person who is suffering from the psoriasis. Psoriasis is an autoimmune skin disease in which the skin on the skin develops red patches and scaly skin, and this type of rashes hote hain, they also affect the joints, and this is psoriatic arthritis. Then symptoms of the arthritis, as I have already explained, it is the pain and tenderness in the joint, swelling and stiffness of the joint, redness and warmth in the joint, decreased range of motion, fatigue and general discomfort, especially in the autoimmune type of joint infections. When somebody has this arthritis, what are the risk factors of arthritis? Especially like we elderly adults, age is risk of the, as the age advances, risk of arthritis increases. Gender, females are mostly more vulnerable for this arthritis. Then genetics, there are many arthritis like rheumatoid arthritis. So even gout, these are genetically transmitted things which may affect in generations at times. Then injuries, any injury to the joint that can also lead to the inflammation of the joint and develops the restricted movement of that particular joint. Then comes the obesity. The obese person, all the time extra weight is put on the joints. That causes the wear and tear of the joint, and mostly the knee joint is affected with the, excuse me. So to apne keep ourselves safe and away from that, we should maintain a reasonably weight regulation. We should not increase more weight. Then comes the exercise, movement of the joint. At times we say, "Ki bhai, main to sara, I do all my household chores. I go for, I walk in my house all the time. I do this, do that." But that is not exercise. Exercise is the thing which has 4 S: strength, stamina, stability, and stretching. If action which has all these 4 points in it, that is an exercise. Otherwise, other things are activities, and activities it is not counted in exercise. and that will not benefit as for the maintenance of the body system. On a joint, when there is an infection in the joint, there are four important M's also come in action: movement, restricted movement. Then we need medicines, the medication of the condition. Then elderly people, they feel when arthritis, they cannot get up, they have pain all the time on the joints, and their mobility is decreased. They feel very lonely. Mindfulness, they are left alone. They cannot move about. So this thing, mindfulness, is also very important in case of arthritic patient. Then comes the surrounding. All those people who are staying with that person, particular person who is suffering from arthritis, they are supposed to support him or her. In a way, they should be around her or him whenever she requires anything. She should be helped. Movements, they should take them out for the social cause, social reaction, recreation, and everything. This will improve the depression or the tiredness of that particular person who is suffering from the arthritis in the elderly age group. Now comes the treatment part. Treatment part is mainly the painkillers, anti-inflammatory medicines, then some support system also, part of treatment. There are some new latest medicine. These are called the change. आपका जो भी system, the treatment system, they support in that. And one more medicine, which is helps very much in pain relieving, and that this is methotrexate. It is a new, not very new, but it was used in the cancer treatment. So this methotrexate is very strong medicine. It stops the proliferation of the autoimmune cells which are not supporting our body. Our body's autoimmune system helps to fight the infection part. But when our autoimmune system cells, they are slow downing, at that time, this medicine helps to stop proliferation of that those cells which are not helping our body in preventing the inflammation. This is how this is very important, but it has very strong medicine. So at times it has its complication and side effects also. Medicines, actually, one should always consult a particular doctor to whom he confide in. Take the advice of your doctor, orthopedician, or any surgeon, particularly to whom you rely, how to deal with the arthritis and how your activities may be restored and treatment goes on. Then comes a diet. Diet is very important part for elderly people. In the diet, many important these days, our kitchens are, most of the time, they are silent. And we order from the outside, we go outside to eat, we eat all types of junk foods most of the time. In the hotels, we have the frozen food that is warmed. Micro ovens, they prepare it and they serve to us. So these foods are not beneficial for the body. So we should, as much as it is possible, we should eat fresh home cooked food, very simple, which dal, pulka, green vegetable. Green leafy vegetables are very important. The spinach, coriander, methi, spring onions, these are very helpful. And other vegetables like green leafy vegetables, carrots, broccoli, avocado, basils, ghee, turai, although very low graded vegetables, otherwise nobody likes to eat them, but they are very helpful. We should make it a habit to have fresh food from the home cooked. There are many ancient dietary things which are available in our kitchens only, and they are very helpful, like turmeric, methi dana, ginger, honey, gond, fox nuts, chana, peanuts, jaggery, pulses, millets, and nuts. These are very important to include in our daily dietary regimes. Nuts are very important, like badam, akhrot, makhana. Makhana is fox nuts. And seeds like pumpkin seeds, kharbuja, melon, sunflower, flax seeds, chia seeds. These are very important and they should be included in our daily day-to-day dietary. We should avoid very spices food, fried food, excessive salt, tinned food, frozen foods, or canned drinks. We should reduce the intake of even alcohol also. But I'll never say to stop it, but it should be reduced. The quantity should be reduced and can be then used it. Then there are some foods which are very important, like millets. These are very nutritive also, and we should avoid maida. Maida is the type of wheat only, but it is polished and all prepared. So we should not use breads, we should not eat cakes, pastries, they should be avoided. But we have, these days we find millet pancakes also. There are powders are prepared in the from the millets also, and we can make pancakes also from millet pancake also. Instead of sugar, white sugar we should avoid. Instead of, we can have jaggery. Good is good. You can make dalia, with put some good in it, and we can use it. Ghee is very important. Rather, nobody likes these days to eat ghee, but ghee is very important. And it, especially for the joints, as our elder people used to say, कि घी खाने से आपके घुटने चलते रहेंगे. They will not, फ्रिक्शन नहीं होगा उसमें और अच्छा lubrication रहेगा joints में. So we should try to encourage homemade food, ancient foods from the kitchen, which are very important and very helpful. Now, when the treatment for the arthritis is not helping to a person, then there are surgical interventions also. These days, and there's a condition when last resort, when doctor says no medicine is helping now, any painkiller, any anti-inflammatory, any methotrexate or anything, nobody is helping the person, then it is advised to knee replacement, hip replacement. Replacement surgery is very much common these days. So knee replacements is not bad. Patients can go, who are in trouble, they can go for the knee replacement, which is a very good surgery and sufferer. Pain relief ho jayega. You will be relieved from the pain. Restoration of mobility and function back, then improved quality of life, and correction of deformities. At times, because of the arthritis, deformities of the joint also develop. Knee replacement is also one of the treatment these days, surgical interventions. because when some processes is applied, so there are many processes which are specifically made these days, metallic processes, metal, and these knee processes, hip processes, they are made from the metals, that is cobalt, chromium, and titanium for the thigh and tibial bones, especially the knee. Knee joint is the processes which is made from the metal, and these are the metals used in it. There are ceramic material also which is used in the processes, and some plastic also, that is polyethylene. Polyethylene is the plastic form which is also used in the processes, and this is making a joint very stable while putting these processes. Joint is it almost becomes normal, but the recovery is not very quick. You have to go for the physiotherapy and the long-term exercises you need for that. At times, patients get tired and they don't want to do physio after the knee surgery, replacement surgery, but that is very, very important. So one must adhere to the advice of your surgeon and do the physiotherapy after the surgery. So the movements uh, becomes normal, pain relieves, and you are comfortable with it. And processes is a good replacement for the arthritis these days. Now, last point which I have to discuss with you is the movement. As the movement is what normal movements which body performs is the flexion, extension, adduction, abduction, circumrotation, pronation, supination. These are the normal movements which are performed by the skeletal system. But main things comes the movement of the joints when we are advancing in our age. Older people, their movements are very important. So they should keep moving. But if they have any difficulty in walking, they should use a cane with a support system. They should walk, but they shouldn't stop walking. They should get up, stop, walk slowly. If they have walkers, they can use walker, or even they can have some grab bars in the room. Hold the grab bars in the washrooms. Also, grab bars should be there, so you don't have the fear of falling. The fall should be prevented always because that will uh, make the person miserable. If a person falls and breaks, fracture their hip joint, so that becomes very miserable for that patient because recovery is very slow in the older elderly people. So the fall protection is very important, very important. Then another movement, uh, if you are better, you can do morning yoga exercises. If you cannot stand up, you can hold the wall against the wall. You can stand and do your exercises. Against the wall, you can do the pressure exercises. Then you at times, if you are not able to stand for long, you can sit on a chair. And sitting on the chair, you can do all the exercises. Your leg, you can thumping. Your stepping movements from the at the knee joint will help as if you are walking. Your hand movements, your stretching movements, your shoulder movements, rotation, these all should be continuously done. So the joint doesn't get stuck up and mobility of the body. This is what I think. Movement is very important. Then diet. Older people doesn't want, they don't feel hungry. भूख नहीं है वो भी खाना but they should eat it. You should plan your food, whatever you want. That should have green vegetables, fruits, anything, your drink, vitamin C, vitamin E, all the vitamin components, all the minerals should be included in your diet. This should help your body to maintain the body and joint movement and everything. And you will be having a perfect life. healthy body. I hope whatever I could say, I have covered all the points. Now, please let
All
me
right.
know.
Everybody should unmute themselves. Everybody unmute and let's ask questions. If any have, please raise your hand or just show me so we go by turns. Ushaji, thank you so much for coming and presenting this. I'm sure we'll get a lot of learning from you. All right, open to question to the floor. Vipin.
नमस्कार उषा जी, थैंक यू वेरी मच। मेरा एक सवाल है कि दर्द तो होती है, तो हाउ डू यू डिटरमिन द पेन इज ड्यू टू आर्थराइटिस और समथिंग एल्स? व्हाट इज द डिस्टिंग्विशिंग फैक्टर फॉर आर्थराइटिस पेन?
Yes, that's very important question. The arthritis related pain will show up on the joint itself because, and there are many tests. If the arthritis related pain, your presentation on the joint will be available. Swelling hai joint mein, to arthritic pain hai. If there is X-ray, you go for the investigation, get X-ray done, MRI done, some blood test also, which will clarify the infection or any joint related problem is there. That means that pain is related to the inflammation. Then in rheumatoid arthritis, you should go for the RA factor. That is rheumatic arthritis related, that is a test factor है वो. If it is more than 14, that means it is positive, and your heart should be also excluded. If you have rheumatic arthritis, then your heart should also be analyzed. Regular checkup होना चाहिए, and get your heart also evaluated that it is not affected.
Thank you.
All right, Inder.
Yeah. Good evening, Usha ji.
Good evening, Bia.
Hello. Tell me one thing. What are your comments about the glucosamine 1500 mg? It is to be taken daily. So it is a supplement. So what do you say? Is it should we take it or not?
देखिए, regarding supplements for the body or joint or whatever, it depends on the person to person. If it suits you and it is helping you, you should go for it regularly. If once in a while you are taking, that carries no meaning.
And then what are the general comments about glucosamine? It's still going on for the last so many years.
नहीं, एक्चुअली क्या है, ग्लूकोसामाइन जो है, इट इज जॉइंट्स, आपको मूवमेंट ऑफ द जॉइंट्स, it will help in your motility of the joint. So it is very important, your motility of the joint should be maintained. If movement is restricted, that means your joint is going to get affected, and it will. And glucosamine is also joint movement को facilitate करता है. That means it is improving the lubrication of the joint and mobility of the joint. So it is very important, essential rather. If you are taking and have you started taking it, you should continue it. It should not be stopped then.
What about if you are taking drinks, drinks, whiskey or anything? Can we take it?
Actually, I'll say if you are taking these medicines or these supplements, you are not supposed to eat alcohol. You are not supposed to drink.
Not supposed to
drink. No, alcohol is not permitted. It is not allowed, rather. It is not good for you if you are taking these supplements and everything and having hard drinks. It will damage your.
But I'm taking for the last so many years. 8 years, 9 years.
No, it's fine. It is very good that
arthritis reversed. Arthritis has been reversed.
Listen,
really, it's a reversal of arthritis.
Listen to me. You should get your liver evaluated. Is your liver normal?
Go ahead.
You should get for your liver analysis, liver function test. Are these normal? Is your liver in the normal structure? If it is not, then you should be careful because it damages the liver.
लगता है ऐसे है कि टॉपिक यहाँ कोई भी हो, गाने का हो, आर्थराइटिस हो, सर में दर्द वाला हो, डेंटल हो, ये सारा ड्रिंक बीच में आ ही जाता है.
नहीं, पर इसका लेसन ये है, IB, द लेसन हियर इज सप्लीमेंट लेना बंद कर दो, पियो.
मैं विस्की लेना बंद कर देता हूँ यार.
सर ये सुबह तो सप्लीमेंट लेते हैं, शाम को दारू पीते.
अच्छा नहीं, अगर ऐसा है ना तो अपना इवैल्यूएशन तो कराना बहुत जरूरी है.
इवैल्यूएशन ठीक है, फिट है.
आप लिवर फंक्शन टेस्ट कराइए, लिवर पूरा एग्जामिन कराइए, हाउ मच इट इज लोडेड विद अल्कोहल, उसका कितना डैमेज हो चुका है लिवर का.
चलो नेक्स्ट क्वेश्चन इज फ्रॉम श्यामलाल.
यस सर.
उषा जी नमस्कार.
नमस्ते.
मुझे नी प्रॉब्लम शुरू हो गई है.
हाँ?
तो मैंने एक आयुर्वेदिक नी प्रॉब्लम, घुटनों में चलने फिरने में हल्की प्रॉब्लम शुरू हो गई है. वॉक कर लेते हैं आराम से, एक्सरसाइज भी कर लेते हैं. तो मैंने आयुर्वेद के डॉक्टर को दिखाया था, पतंजलि वाले को, जिसने करीब 2-3 लाख पेशेंट देखे हैं. तो उसने मुझे बताया कि जो कैल्शियम वाली चीजें होती हैं, जैसे कि मखाना है, सफेद तिल है, खसखस है, और उन्होंने कुछ तेल भी बताए मुझे लगाने के लिए, वो मैं प्रयोग कर रहा हूँ. तो आपके विचार से ये मुझे कुछ हेल्प करेंगे?
देखिए, what about the Ayurvedic these things? Actually, these are not harmful at all. तिल हम बचपन से खाते आए हैं, मखाना हम बचपन से खाते आए हैं, तो they are not going to harm our body any time. They'll helpful. They will be helpful to you.
Thank you, ma'am.
Yeah.
Thank you.
But will they solve the problem? That's the question, right?
What is the problem? Sorry?
No, taking all those things, till and other things which you have been doing for years is good. It helps, like you said, but does it help reduce the pain, or how does it help is the question.
No, actually, it will not improve. If there is any inflammation inside, any destruction of the joint has already set in, that is not going to help.
Right.
Improvement is not that quick. You may, the further deterioration रुक जाएगा, but the damage which is already done, that will not recover by anything.
नहीं, reversal is possible, I think. Arthritis reversal is possible.
नहीं, it is not very quick नहीं होगा.
It's the latest research, I think.
नहीं, if you are doing exercises, your diet is okay, everything is normal, so you will feel better. But whatever damage is done, that वो तो ठीक नहीं होगा. अगर कार्टिलेज अंदर से जल गई है, वो गल गई है, साइनोवियल मेम्ब्रेन अगर सूख गई है अंदर, तो वो कैसे ठीक होगा? जो कहा
बोन के अंदर जो आपके स्लाइडिंग वो है, स्लाइटली इट इंप्रूव्स. Reversal of arthritis is possible.
शराब पीते हो ये तुम?
You have to take lot of efforts.
Have you taken a drink already this evening? इंदर?
ओ छाड़ है तुम ड्रिंक लेके ड्रिंक. मैं बहुत सीधा बच्चा बना हुआ है.
Next question is Suresh.
Yes.
You were saying that one of the main causes for the arthritis is infection in the joint. What are the main causes of infection in the joints, and how do the infections occur?
This is most commonly is the staphylococcal infection, which is results in the infection, early childhood infection of the throat or any lung infection, and that is not taken care of nicely at that time. That may result in the arthritis later on, and that develops the rheumatoid arthritis mostly, and that is very, very risky arthritis, which involves even heart also, and joint, of course, joint is involved. So you should be very careful about any infection, throat infection, even glossitis, stomatitis, oral infection, dental infection. These are very important infections which should be taken care of. Antibiotic, they should be treated on time.
All right, next question is from Cabra. Cabra, unmute. Cabra, unmute, please.
I cannot hear.
Narendra?
Yeah, I'm there.
Okay.
Usha ji, 3 months back, suddenly, when my right leg twists a little, जरा सा भी टर्न होता था तो मेरे को नी के साइड में पेन होता था। और उस पेन के साथ वो पेन मेनली होता था कि जैसे अपन सिटिंग पोजीशन में बैठे हुए हैं और खड़े होकर चलना शुरू किया तो होता था, या फिर नाइट में बिस्तर पे लेटे हुए हैं और कवर्टली और पैर ट्विस्ट हुआ तब थोड़ा होता था। बाद में जैसा आपने बोला पेन किलर्स वगैरह ऑर्थोपेडिक से बात करके पेन किलर्स वगैरह लिए, वो ठीक हुआ, मतलब टेम्परेरी रिलीफ मिला। फिर उसके बाद मैं तिल तो पहले से लेता था, मैंने उसमें चिया सीड्स इंक्लूड किए और गम इंक्लूड किया डेली, वो मैं ले रहा हूँ। और साथ में मेरे कुछ फ्रेंड जिनको की योगा एक्सरसाइज अच्छी आती है, उन्होंने मेरे को कुछ लेग एक्सरसाइजेस बताई और एआई से पूछ के आई वाज टोल्ड कि साइकिलिंग इज द बेस्ट एक्सरसाइज फॉर दिस। तो मैंने साइकिलिंग भी शुरू किया। तो अभी 3 महीने बाद ऑलमोस्ट आई कैन से आई एम ओके, अभी कोई प्रॉब्लम नहीं है। अच्छा, ड्यूरिंग दिस पीरियड मैं टेबल टेनिस खेल पा रहा था। टेबल टेनिस खेलते समय मेरे को कोई पेन नहीं होता था, सिर्फ ट्विस्ट होने के समय मसल में पेन आता था, जॉइंट में नहीं।
Actually, the cause behind this एकदम आपका जो सब मुड़ने से होता था, that may be ligamental torsion, some ligaments around the joint which are attached to the ligaments attached to the bone and the joint, some twisting, some torsion in the ligaments. At times it happens, and because of that you felt that twisting pain.
Yeah, okay. But anyway, cycling और ये जो गम और वो अभी रूटीन बन गया, वो तो डेली लेना ही है।
Actually, Kabra sahab, your joint is not involved in any case. Only outer.
Yeah, my joint is not involved. Yes, outer part only.
So all the activities which you are performing on that particular joint are normal. Only the ligament, muscle or ligament that is tortuation, uska ho gaya torsion hai. Because of that particular position में pain हो रहा है आपको.
Yes. Wonderful. All right. Next question.
एक्सरे तो करा लेना चाहिए काबरा साहब.
हाँ, बोलिए.
एक एक्सरे करा लेना चाहिए उस पर्टिकुलर जॉइंट का कि जॉइंट पोजीशन है कि नहीं.
अच्छा, ओके, या.
है ना? You can go for an x-ray.
All right. Any more questions?
Right. Thank you.
Sachdeva, Christian Sachdeva has a question.
सरीन साहब 1 मिनट चाहूंगा मैं.
Okay, next after that, after Christian.
जी.
Usha ji, first of all, thank you for your presentation and everything. Based on my wife's experience, she had a knee joint pains for years. And being in medical line, she never wanted to go for knee surgery. So to my viewers, I think I'm just telling my experience. There is something called lubricant injection right on the knee. Because she was saying that knee surgery time is like their lifetime is about 10 years, 15 years or something like that. So she was trying to postpone and should try to avoid knee surgery. But there is some lubricant injections she was getting regularly, and that helped her a lot. So I'm just
that is true. That is very true. These injections are the steroid injections, which are given to the particular point, which is the maximum painful point. On that particular joint point, the steroid injection is given, and because of that steroid effect, the improvement is there.
So my point to tell was for other people, avoid joint replacement surgery as far as you can, because that has only limited life expectancy.
Actually, you are very right. It is more 12 to 15 years the maximum life as it is quoted and experienced by the people. Then you have to again go for the processes change everything.
Right.
So
All right.
definitely it is so far so good. You can keep your things normal.
Right.
So don't go for it and prevent and exercise, do exercise and prevent all the exertion and excess weight on the joints and everything.
Yeah. Lot of people don't know about that lubricant injections. That's why I was trying to tell.
There is one more thing, hyaluronic acid injections also there. Steroid and hyaluronic acid. These both are injected on the point of the pain.
Thank you.
Yeah,
All right. I have more questions? Shyamlal.
सर हाँ सर उषा जी ऐसा था कि जब मैं करीब 20-30 इयर्स पहले मेरे लेफ्ट हैंड की कोहनी बिल्कुल जाम हो गई थी, तो मैंने आर्थोपेडिक सर्जन को दिखाया था, तो उसने 7 इंजेक्शन का एक कोर्स मेरी कोहनी में दिया था। हर हफ्ते एक इंजेक्शन लगता था। अब 30 साल हो गए, मेरी कोहनी बिल्कुल ठीक है उन इंजेक्शन से लगाने से। तो जैसे ही कृष्णा जी ने भी पूछा लुब्रिकेंट इंजेक्शन के बारे में, तो क्या इस तरह का इंजेक्शन मैं अपने नीज में लगवा सकता हूँ?
बिना एडवाइस के नहीं. If you're a practitioner, if you're treating surgeon, your doctor advises it, you can go for it.
नहीं, डॉक्टर से ही लगवाएंगे मैडम, आर्थोपेडिक सर्जन से ही लगवाएंगे.
एक्चुअली आजकल प्लेटलेट रिच प्लाज्मा भी आता है, उसको भी आप जॉइंट ट्रीटमेंट में काम लेते हैं. तो if somebody can afford that, you should go for that also.
Thank you, ma'am.
All right. More questions? Okay. I think thank you, Usha ji.
Thank you, Sona Master, to you for arranging all that, you and Shankar.
Thank you so much.
You guys are all welcome. Yeah, this is all for us. And
you're welcome. Most welcome.
Anyway,
thank you.
Keep doing, yeah.
Thank
Good.
you goes to Dr.Usha because she spent her time here with us.
Yeah.
And especially
every week Inder gets told to stop drinking. So
no, ये लास्ट शेयर इंद्र के लिए है. वो कहता है आए कुछ अब्र मतलब पानी, आए कुछ अब्र कुछ शराब आए कुछ अब्र कुछ शराब आए, इसके बाद आए पेन आए, कुछ आए जो आए, शराब पीते जाओ बस.
आए कहाँ से आएगी, भाग जाएगी वो.
प्रॉपर एडवाइस. बोले मीनू जरा नमकीन लेके आना मेरे लिए प्लीज.
हाँ, ये मीनू का काम ये है, नमकीन लेके आना.
So Inder, there is a famous quote which says, I read all about drinking that it was so bad, so I stopped reading.
And then any effect? Yes, stop.
But Shankar ji, it doesn't read or even.
मैंने पढ़ लिया तो फिर गया.
Also, I'll definitely thank Dua Saab join us. He is a BITS Pilani Ranchi graduate. He's friends of Shyamlal and president of, I think, United Kanpur or UP Powers.
That's what I was thinking. I haven't seen him, Chess Dua.
Yeah, he is Shyamlal's friend, and he's our BITS Pilani sister concerns graduate.
दुआ साहब अनम्यूट करके कुछ बोल दो
यार.
दुआ साहब अनम्यूट करो अपने आप को. आप
अनम्यूट करके कुछ बोल दो. वो ऐसे ही बोले जा रहा है अनम्यूट.
ये प्लानी वाला को अनम्यूट करना बहुत मुश्किल लगता है.
हाँ जी, दुआ साहब तुझे कितने साल पास हुए सी?
Sona, there is one consolation. If Dua had attended this Zoom meeting for last 2 years, he would know how to unmute.
ये तो म्यूट है. दुआ ने म्यूट है, भी अनम्यूट नहीं कर रखा है. दुआ साहब अनम्यूट करो यार.
दुआ साहब अनम्यूट कर लो. अब यहाँ अपने पोते ने बुला लो, कर देगा आके.
सोना आपको एक सेशन पूरा जो है
हो गया, अनम्यूट हो गया, अनम्यूट हो गया। हाँ जी,
हो गया।
दुआ जी बोलो।
हेलो, आवाज आ रही है जी?
हाँ जी, हो आ रही महाराज।
आ रही है।
अब आ रही है।
Thank you very. I am grateful to Mr. Shyamlal who has invited me to join this program. I really enjoyed this program, and you have got all the points. I'm thankful to all of you, and Dr. Saab also. I'm thankful to Dr. Saab who has given so
यार
much.
दुआ किहड़े साल पास आउट होए सी ਤੁਸੀਂ ਪਿਲਾਨੀ ਤੋਂ ਰਾਂਚੀ ਤੋਂ?
हाँ जी, रांची पढ़े मैं तो
नहीं
रांची
किहड़े साल पास आउट होए हो?
72
वो बहुत छोटा बच्चा है यार, तो छोटा बहुत।
छोटा है।
1972 यार, बहुत पुराना है।
हाँ, चलो इसकी रैगिंग करो।
नहीं भाजी बोलो किसी और।
नहीं, you can. You are all of you are senior to me.
रैगिंग कैंडिडेट है ये, रैगिंग कैंडिडेट है।
Ragging candidate. All right, guys. Next week we have our singing program, which will be Shama and Parvana songs. So I have about 12, 15 people, 13 people joined. So if you haven't sent your name, please do. That'll be September 2nd, same time, same place. थोड़ी गायकी होगी, उसके बाद फिर September 9th को श्यामलाल जी बोलेंगे हमारे कर्मा के ऊपर, और 16th को वापस डॉक्टर उषा माथुर आएंगे हमारे हाइपरटेंशन और हिडन सॉल्ट और हार्ट के ऊपर बोलने। तो ये हमारा प्रोग्राम नेक्स्ट 4 वीक्स का। So we'll see you guys next week. Shama Paravana. With that, I say
Thanks,
goodbye.
everybody.
Thank you again.
Thank you.
Thank you. Bye-bye.
Bye-bye.
Thank you, everyone.
Bye bye.
Thank you, Usha ji. Thank you.
Bye bye. Thank you.
Thank you so much.
Thank you.
All right.
Bye.
Good night. Good night. Good night.